I'm Dr. Ken Landau. Thanks for watching. Let's talk about the relationship between hydroxychloroquine and COVID-19. Is there any, is the question. Well, the whole story started with a researcher from Marseille in a video that detailed phenomenal success in treating patients who had COVID-19. What they did is they looked at the test, and the test went from positive to negative, 65% of the people, after just 5 days worth of treatment. That's as opposed to about 20% of the people receiving the placebo therapy. Unfortunately, not all of the patients who had received the hydroxychloroquine were included. Some of them got worse, some of them were lost to follow-up, so the numbers aren't anywhere near as impressive as the study suggested. Well, we've known that hydroxychloroquine and chloroquine can act as antiviral agents, at least in the laboratory. The hydroxychloroquine appears to be safer, appears to be more potent as an antiviral agent. But the question is there enough? Is there enough that gets into the system? Well, in the laboratory, we need somewhere around 4.5 to 17 micromoles to reduce the viral concentration by about 50%. But if we look at the amount that builds up in the tissues in a person who's taking the drug, and taking the drug, say, for lupus or for rheumatoid arthritis, they only have about a level of 1 micromole, so nowhere near enough. Now, additionally, there's some significant potential for cardiac toxicity. If you take the hydroxychloroquine, it may increase what's known as the QT interval on your electrocardiogram, and that means that it changes the way your heart repolarizes, and in the process, it interferes with the potassium channels, and in doing so, puts your heart at risk for severe ventricular arrhythmias that may indeed cause death. And the risk is increased in anybody who has any structural abnormality of the cardiovascular system, and it just so happens that COVID-19 causes some significant damage to the cardiovascular system, damage to the cells that line the arteries in the heart, called an endotheliitis. And if you throw on some of the azithromycin, well, the azithromycin by itself increases the QT interval and also leads to an increased incidence of sudden cardiac death. So the combination, that's pretty toxic. Well, anyway, getting back to the main story, we have the doctor from Marseille, Dr. Raoult. He started the interest, piqued the interest. Then we had a cryptocurrency trader from the East. And then we had a New York lawyer. They wrote a paper, took off on Twitter. Laura Ingraham invited them on her show. Then it was championed by some of the personalities at Fox, Ingraham and Hannity. They had friends of the president who were telling him how great the medicine was. Had a doctor in New York, Dr. Vladimir Zelenko, who was pushing the drug, saying that it was part of a 3-drug cocktail that kept all of his patients out of the hospital. Trump, in March, said that he just had a feeling that the drug was going to be a game changer. Well, according to Dr. Fauci, who took the stage a moment later, he said, oh, no, it isn't. We don't have any scientific evidence that the drug works. Well, just because the president said it, the number of prescriptions jumped shortly afterward by about 2,000%, according to the Journal of the American Medical Association. And Trump continued to tout it even in May. He took it as a potential safeguard after he had some maybe exposure to the virus at the White House. He discussed it supposedly with his doctor, Dr. Sean Conley, and they together decided that there was more benefit than risk. Well, Trump further went on to claim that thousands and thousands of workers were taking the medicine, the frontline healthcare workers, they were taking it to prevent what he called a horrible disease, or, as he said, whatever you want to call it. Well, the American Medical Association said, The American Nurses Association said, we don't have any evidence that a bunch of frontline workers are taking the medicine. Actually, the medicine, access to the medicine was restricted by state medical boards. We had a study that they tried to do at Duke, looking at 15,000 healthcare workers. Well, only about 550 signed up. Same story in New York City. Just tried to do a study. Frontline healthcare workers, 125 signed up. Then this whole story with the pushing of the government and the president led to the emergency use authorization by the Food and Drug Administration at the end of March, so that if a person was hospitalized and couldn't participate in a research study, that person could be given the hydroxychloroquine. Well, in addition, the government under Trump's leadership went on to stockpile tens of millions of doses. Trump was quoted as saying it's a game changer, the hydroxychloroquine. So the government has distributed to date about 31 million tablets of the hydroxychloroquine to the state and the local health departments, to the hospitals and research institutions. And right now the stockpile still has 63 million tablets left. But the FDA has withdrawn the emergency use authorization and said that the drug is unlikely to be effective. And as a matter of fact, it's associated with significant side effects. Well, that obviously didn't go over too well at the White House. So we have some studies, and let's look at the studies. One we have a veterans study, Veterans Administration study, looked at patients retrospectively. So they looked at the records of patients, and they found 368 VA patients, average age in excess of 65. Patients had COVID-19. They were treated with hydroxychloroquine by itself or with azithromycin, or they were treated with the standard therapy. Patients who were treated with the standard therapy had a death rate of 11%. Patients treated with the hydroxychloroquine had a death rate of 28%. 11% standard, 28% with the drug. Obviously, that's not a significant improvement. Now, according to President Trump, this report was from Trump haters. Remember, it was from the Veterans Administration. Well, additionally, we had reports from France saying the drug doesn't work. We have reports from Brazil saying actually high doses of the medicine seem to be associated with significant cardiac toxicity, and initial enthusiasm from China and from the United Kingdom and from Italy. They lost interest. Then there was a study coming out of New York City at New York Presbyterian Hospital, Columbia University. And what they did was they looked at patients in March and in April. They gave them, within a short period of time of entering the hospital, they gave them 600 milligrams day one, 400 milligrams each day, days 2 to 5. Well, they stopped the azithromycin in the middle of April, stopped the hydroxychloroquine at the end of April. And they had data by that time on about a little less than 1,400 patients. Now, 50% of the patients were given the medicine within 24 hours after hospital admission, 85% within 48 hours of hospitalization. They looked at the likelihood of intubation or death. And they found if they didn't adjust the data, the patients who received the hydroxychloroquine had about a 2.5-fold increase in the likelihood of either needing ventilation or dying. Now, after they corrected for some of the severity of illness at the time, well, they found that there wasn't any benefit anyway. But the most important study that came out on the subject came out in the Lancet. It was published online in the middle of May. It was a national registry of 671 hospitals in 6 continents. They had data from the end of 2019 all the way through March of 2020. Patients supposedly hospitalized and treated within 48 hours. Significant number of patients on chloroquine or chloroquine plus azithromycin or hydroxychloroquine by itself or in addition to a drug like azithromycin. And they found that if you look at the standard mortality rate, the mortality rate among patients receiving just the standard kind of therapy, death rate was 9%, but in those people receiving chloroquine, it was 16%. In hydroxychloroquine group, it was 18%. And when you combine the chloroquine or hydroxychloroquine with azithromycin, the death rate was even higher. So that suggested, oh my goodness, we should not use this medicine. And they looked at ventricular arrhythmias and found basically the same thing. In patients receiving standard therapy, 1/3 of 1%, 1/3 of 1% suffered ventricular arrhythmias among patients receiving the chloroquine or the hydroxychloroquine or the combination of the anti-malarial plus the macrolide, drug like azithromycin. Well, the incidence of ventricular arrhythmias was between 4 and 8%. Well, it was an observational study, can't for cause and effect. They didn't measure the QT interval, so we don't know that the patients who died because of cardiovascular disease. But it was thought to be a pretty good study, and the lead author, Dr. Mandeep Mehra, who was the editor-in-chief of the Journal of Heart and Lung Transplantation, is the medical director of the Heart and Vascular Center at Brigham and Women's Hospital, a professor at Harvard Medical School. And then we had 3 others. One was a doctor in Zurich. Another was Sapan Desai. He actually was the president of the company that provided all of the data that was used to come up with the paper. Then we had someone who just turned out to be his brother-in-law, who was at the time on the faculty at the University of Utah. Well, because of all this negative data that came out, the World Health Organization basically immediately halted their trial. And they said, anyway, that it looks like the drug isn't of any benefit, the hydroxychloroquine. And they don't advise anyone to use the hydroxychloroquine who wasn't part of a clinical study, or at least being carefully followed by a physician. Well, the Lancet article also caused the drug company that had the major production facility, Sanofi, French company, major French company, they stopped recruiting patients for their study. But after the publication of the study, very shortly after the publication of the study, there was significant question by outside experts about the data that was used to come up with all these conclusions. And especially because the one author, that Dr. Desai, he happened to be the president and the founder of this thing called Surgisphere. But the other authors of the paper, because there was so much question, the other 3 authors said, hey, let's get an independent group together and have them do a peer review of the data and see if the data really is legit. Well, Surgisphere had some problems. They wouldn't even list the countries that were in the different continents that supposedly were providing the evidence. And as a matter of fact, when it was looked at relatively carefully, the journal, The Scientist, sent some feelers out to find out if the states that were heavily hit by COVID-19 had presented any evidence to the Surgisphere. And none of them did. And then, as a matter of fact, on Surgisphere's website, it listed some kind of collaboration with the University of Minnesota and Stanford University, but those institutions had no record of ever working with Surgisphere. Well, this led to a letter signed by 180 different scientists, researchers throughout the world. And they said the data doesn't seem to make any sense. And they didn't even understand how Surgisphere was able to get a complete set of data in such a short period of time. There was a question about how the data was adjusted. There was a question about the data from Africa. It showed an enormous percentage of patients with complete medical records from Africa, when the doctors from Africa, the experts from the different countries in the different areas, said there's no way that we could have provided that kind of information. So the investigators weren't able to verify or vouch for the legitimacy. And then there was a simple error, and the error was that there were more patients who were reported as dying from Australia, and according to the paper, than Johns Hopkins said died in Australia. So there's an issue. Well, it was found that, well, we included a hospital from Asia in the Australian data, so they corrected that, all 4 of the authors. But the principal investigators, absent Dr. Desai, they were really unable to vouch for the legitimacy of the data. So as a result, the Lancet, the journal that had just basically the previous several weeks, had published the paper. Now they expressed some concern. And as a matter of fact, 3 of the 4 authors of the paper, absent again Dr. Desai, they said, look, you're not providing the information to the third party, to the people we've hired to look at the data, to verify the data. And as a result of your not doing that, we want the paper retracted. So the article was retracted by Lancet. Well, that's significant as far as medicine is concerned. Here we have a major journal with a major paper saying that the data can't be guaranteed to be accurate. Well, that caused the Data and Safety Monitoring Board of the World Health Organization to say, hey, let's start our study again. And then, as a matter of fact, at the same time, basically, there was another paper that was published in the New England Journal of Medicine with data also from Surgisphere. That was retracted, actually retracted within several hours of the Lancet paper. And then we had another paper, yet another paper, in the New England Journal of Medicine, this time from the University of Minnesota. And what they did was they looked at hydroxychloroquine as a preventive. They looked at hydroxychloroquine in people who were exposed to COVID-19. These were healthcare workers for the most part. And for the overwhelming majority, they didn't have any underlying health condition, but some of them had asthma or diabetes or hypertension. They looked at 400 people about who received the hydroxychloroquine and 400 people who received placebo, and they found that it didn't make any difference as far as the percent of people who contracted the disease was 12 to 14% in both groups. But 40% of the people receiving the hydroxychloroquine had some side effects: nausea, upset stomach, diarrhea, fortunately nothing worse. Well, the study was done over the internet. Self-reported data, doctors didn't see the patients, small size of the study. At least 20% of the patients didn't even take all of the medicine. So that led to some question about the legitimacy of this paper too. And actually, Dr. Steve Nesson of the Cleveland Clinic, he's head of cardiovascular medicine, he said that the data is really of poor quality. Well, then subsequently, we had the National Institutes of Health. They had a study. And for the 4th time, the Data and Safety Monitoring Board met in late June. And what they said was that the drug doesn't seem to be harmful, but it certainly isn't helpful, so we're recommending to the National Heart, Lung, and Blood Institute, that's also part of the NIH, that they stop the trial. Well, they had already accumulated about 470 patients of a 500-patient anticipated study that had begun at Vanderbilt University in April. And they said, let's just stop it because we don't have sufficient data. So let's go back and look at what the FDA has said over time. Let's look at the genesis. Well, in 2017, long before COVID-19 came about, the FDA said, watch out for hydroxychloroquine. It can cause some cardiac negative effects. It can cause a cardiomyopathy. It can cause this prolongation of the QT interval. It can cause arrhythmias. And it can cause hypoglycemia. Your blood sugar can go way down. And then because of the political pressure, in March of 2020, we have the emergency use authorization. And less than a month later, in mid-April, the FDA issued a warning for the potential serious cardiovascular problems that they had previously said. They just reminded everybody, hey, that this drug, the hydroxychloroquine, well, we haven't approved it as being a safe and effective therapy for the COVID-19. Then about a month later, the president announces he's taking the hydroxychloroquine. And less than a month after that, the emergency use authorization by the Food and Drug Administration was revoked. And they said, basically the FDA said, we don't have any evidence that the drug is of any benefit. Now, Peter Navarro, who's at the White House, he insists that the FDA is going to have blood on their hands. He says it's the deep state that's blindsiding the administration. He says they hate the administration. He helped distribute about 19 million pills. But medical researchers, they kind of applauded the FDA withdrawing the emergency use authorization because they said there's no evidence that the medicine works. And by the way, around the same time, the World Health Organization stopped the study because they said it doesn't seem to work. And there was a big study in United Kingdom called the recovery trial. And that was stopped around the same time because they said it just doesn't seem to work. So that's really the story of hydroxychloroquine and COVID-19. It's a story that got off to rousing a start with social media coverage, then got into the mainstream media, was championed by press conferences with the president, widely disseminated on Fox. When Trump had pressure on the FDA and on BARDA to stockpile the drug and to issue the emergency use authorization. So we did indeed stockpile it, did indeed have the emergency use authorization. Well, the emergency use authorization has now been retracted. The FDA says you got to be very careful of the drug. The NIH says they can't find any use for it. The World Health Organization says it's not really of value in treating COVID-19. So it seems to have diverted our attention from really more important matters. We've had a lot of negative reports on the drug. Now, some of the negative reports have themselves been severely criticized and, as I mentioned, retracted. We had a report from the University of Minnesota showing it didn't work, but unfortunately that was kind of a sloppy report. So after all of this period of time, all we can say is there is no evidence that hydroxychloroquine is of any benefit to somebody either as therapy or prevention of COVID-19. Anyway, thanks for watching. If you enjoyed the show, please tell a friend, consider subscribing so you'll be notified as we post new videos. I appreciate your interest. I'm Dr. Ken Landau.